Hey guys, welcome to Medical Mondays. We're going to get through muscle and bone injuries today using the power of magical videos, and we're going to look at some of the more common muscle and bone injuries that you'll come across when responding to calls. So in this chapter, we're going to be covering musculoskeletal injuries, some of the more common injuries that you're going to come across when responding to calls. So the types of musculoskeletal injuries that we're going to look across, there's four basic types. There's fractures, dislocations, sprains, and strains. Fracture injuries. Fracture injuries could be a partial or a complete break in a bone. They could be chipped, they could be cracked, or they could be completely broken into two pieces. It's important to expose the area to see if we're dealing with an open fracture or a closed fracture, which sometimes is hard to do over clothing. Dislocation injuries. Dislocation injuries are a displacement or separation of a bone from its normal position. The most common places are shoulders, elbows, hips, and knees. Sprains are tearing or stretching of ligament tissue. In areas usually like the wrists, the ankles, those areas generally have more ligament tissue and are more prone to sprains. Sprains can happen in any part where two bones come together. Strain injuries. Strain injuries are when the muscle fibers rip off the bone themselves. Common places are the neck and the lower back. However, strain injuries can happen anywhere where bone muscle comes together. How to splint. Some basic rules to take into consideration before splinting are A. Expose the area and determine whether you're dealing with an open or closed fracture. B. Determine the circulation, mobility, and sensation of the actual injured part. And C. If we have the appropriate device to actually immobilize, or best just to hold in place until your EMS arrive. It's also important to make sure that when you're determining what type of splint to use, that it immobilizes from the joint above to the joint below the actual fracture site. The more common signs and symptoms of a musculoskeletal injury are pain, swelling, deformity, inability to use the affected part. It's an important part of our primary and secondary survey to actually expose the area and again assess the circulation, mobility, and sensation of the injured part. General care for musculoskeletal injuries includes four basic concepts. We use the acronym RICE to remember all four concepts. The R stands for rest, the I stands for immobilize, the C stands for cold, and the E stands for elevate. The R, rest, generally following an injury, we don't want individuals to move around. Could potentially cause more injuries, and it also increases the blood flow to those areas. The I stands for immobilize. General concept is to immobilize in the position that we find it. If there is extreme deformity, we're best just to hold in place until EMS arrives. The C stands for cold. Applying ice, which we have ice packs in our trauma bags, will help with the swelling. Most of the pain is caused from the actual swelling to the site itself. So by applying ice to the immediate area, it'll cause vessels to constrict and minimize the amount of more blood and fluid moving to the injured site. The E stands for elevate. Part of the immobilization process, if we can elevate, we minimize the amount of fluid also moving to the area. Upper extremity injuries. So as you see here, the shoulder area consists of the collarbone, the shoulder joint itself, and the clavicle bone. These areas are prone to fractures, but they're also prone to dislocations. It's important, as you can see by the lower diagram here, all the arteries, veins, and nerve endings that are going through these joints in the shoulder area. They also go through the elbow joint. So it's important to assess mobility, sensation, and circulation to see if any of these injuries around joints have actually affected any of those three things. The lower arm is prone to fractures, and then as we get into the hand, made up of lots of little bones, are more common areas for sprains and strains. Over the next couple of slides, we'll focus in on the care for upper body injuries. Forearm, wrist, and hand injuries. These can be very challenging to assess properly, especially if the patient's wearing clothing. It's important to expose the area as part of the primary and secondary survey. The radius and ulnus bone that make up the lower arm are very susceptible to fractures. They're also very susceptible to being open fractures. So it's important to part of the primary and secondary survey to expose the area and make sure if we're dealing with an open fracture, also known as a compound fracture. The wrist and hand are lots of little bones that come together. They're held together by lots of ligament tissue in those areas. These areas are prone to fractures, but they're also prone to sprains. We treat them the same way using the acronym of RICE. Lower body extremities. So part of our primary and secondary survey, it's important that we assess these lower body extremity injuries. Starting with the hips, to the femur, to the knees, to the lower leg, to the actual foot itself. So when we start with the actual hip area, it's important, using the example, for instance, with a pedestrian that's struck, that we assess that hip area properly. Now, we will be covering pelvic injuries in a later chapter. However, it's important to remember that the femur comes attached to the pelvic area. So let's look at lower extremity injuries. In a later chapter, we'll focus specifically on the pelvis itself. The top of the femur attaches into the pelvis area, the hip. The hip area is prone to fractures, but it's also prone to dislocations. The femur itself is considered one of the strongest bones in the body. It requires a significant amount of impact directly or indirectly to fracture a femur. It's important to also recognize that the average person could lose 1 liter of blood in an actual femur area, being that the femur is surrounded by lots of muscles which will retain blood. It's important to assess the area, expose the area to make that determination. The lower leg, which consists of the tibia and fibula, is important to assess properly because it's another area, like the lower arm, that is susceptible to deformity, as well as the ankle and the foot, which consists of lots of little bones with ligament tissue. Those areas are also prone to fractures, but they're also prone to sprains because of the amount of ligament tissue in those areas. Knee injuries. Knee injuries are where the femur and the fibula and tibia come together. They're all held together by this ligament tissue and the patella itself. These areas are prone to fractures, but they're also prone to sprains. You see the common terms that people refer to: MCL injuries, ACL injuries, which is the ligament tissue that helps support that area. These areas are prone to fractures, but they're also prone to stretching and tearing of this ligament tissue. In this video, we're going to review on how to apply a tube sling. This is a great sling for any upper body injuries, such as a shoulder, humerus bone, or the radius or ulna. It's important, as we've been saying in this module, to assess the area before we do any sort of immobilization or motion restriction.
Check for normal skin color and temperature below the site of the injury. Have the person support the arm of the injured side. Place a triangular bandage over the forearm and hand, tucking the edge under the arm. Twist the end of the bandage to secure the elbow. Tie the bandage's ends together beside the neck. Pad the space between the arm and the body. If necessary, and if doing so won't aggravate the injury, secure the arm to the body with a broad bandage. Once the sling is in place, recheck skin color and temperature.
Traction splinting devices. Although Barrie Fire doesn't carry any traction splinting devices, the local EMS service does. The most common one that's used is the commercial name Sager splints. Sager splints are used to mobilize using the power of traction, and it locks into place. It's important that we know how to use these devices in case we're asked to assist the EMS service on scene to apply a traction splinting device. It's important to understand that these are only used for femur and lower leg injuries, and at no time they're to be used when there's joints involved.
Position the splint so that it extends from the hip to the ankle and secure the upper thigh straps and the ankle straps. Position the tensor straps. Apply the correct amount of traction with the splint according to your local protocol and the manufacturer's recommendations. Next, secure the tensor straps.
Another skill that we're going to review is how to mobilize using soft splints, using triangular bandages and blankets. All our apparatus carry blankets and have triangular bandages in the blue bags. You'll see how the individual immobilizes a lower leg using a blanket and a couple of triangular bandages.
Use a splint to immobilize a bone, muscle, or joint injury. Check for normal temperature and skin color below the injured area before and after immobilizing the limb. Follow these guidelines when applying a splint. Immobilize the injured part in the position in which it was found. Ensure the splint is long enough to extend above and below the injury. Remember to check circulation again once the splint is in place. If the area is cold or pale after immobilizing, the splint may be too tight. Loosen it gently.